Welcome to the Mama Needs a Moment podcast. We're your hosts, Chrissy
and Cindy,
co-founders of Her Health Collective.
We are two moms obsessed with revolutionizing the way moms take care of themselves. We are so glad you're here. Let's dive in.
Navigating the healthcare system can feel overwhelming. Where to turn and who to trust are common questions that come up for parents. Bonnie Hui-Callahan is a pharmacist and mother of four. Her pharmacist experience ranges from retail pharmacy, managed care, pharmacy education, and health tech, where she currently works. In 2021, she co-founded the Clinician-Leader, a digital course and coaching business aimed at empowering clinicians to tap into their leadership potential. Outside of her 9-to-5, Bonnie coaches pharmacists in resume writing, networking, interviewing, and negotiating. She resides in Orange County, California, with her husband of 13 years, her 3 sons and 1 daughter, ages 3 to 9. Today, in part 1 of our conversation with Bonnie, we explore different ways to make healthy habits stick, top tips for protecting our kids' health, and exploring the CDC's updated vaccination schedule, including a discussion of hepatitis B and why it is something you might be hearing about at the doctor's office and what you can do to protect yourself.
Bonnie, we are so excited to sit down and talk with you. This is a topic we have not covered on Mama Needs a Moment before, so this is a first for us. And I'm really excited to dive into some of the questions we have planned. But first, we always like to start by asking our expert guests who you are. And our twist on it is that you got 2 minutes and that's it. So in 2 minutes, we would love to know who you are, why do you do what you do? And because this is a podcast for moms and about moms, we'd also love to know a little bit about that mom side of your life. What are your current struggles as a mom?
Awesome. Sure. Yeah, I'll keep it sweet and simple. My name is Bonnie Hui-Callahan. I'm a pharmacist by training and a mother of 4. My kids are 3, 5, 8, and 9. And, life is crazy, as you can imagine. I'm also a member of the Pharmacist Moms Group. We are the largest online community of pharmacists in the United States. And we provide each other not just professional support, but personal support as well. And so, as a mom of 4, I know I myself need that type of support. From a struggle perspective, I think right now it's the morning routine. We're all in the thick of it. We're almost at the end of the school year. Regardless, there's a morning routine where we're getting the kids up and breakfast and teeth brushing and shoes on and getting in the car, all those things. I'm doing it myself 3 days a week while my husband's in the office. So it's a lot. And I feel like maybe one day it'll get easier, but it hasn't yet.
No, it changes. It just changes. I say this to everyone, right. Which we'll get into later.
Yeah, absolutely. So yeah, I just feel like the morning routine is a struggle for me right now, and who knows when it'll end. But one of these days, I'll tell myself that.
It is such a struggle. Keep fighting the good fight.
I'll try. I'll keep trying.
So I'm going to do the fun part. Well, that was fun. This is just like a fun, quirky question, but you get to pick the number. So between 1 and 31.
How about 28?
Oh, okay. Well, this is pretty easy. So okay. Good for you. What are you most looking forward to?
Oh, in general?
I guess in life. That's all that it's. Yeah, you take it wherever you want to take it.
I'm most looking forward to, I am most looking forward to the day when I no longer have to buckle anyone into the car seat and I can just get in the car and leave within maybe 30 seconds, which is, as single folks way back in the day, that was easy, right? And
so rejoice in that. Yes, that is, yes. There's definitely some, but you don't escape throw up in the car. Just so you know, you don't have the car seat, you don't have to buckle them in, but you still get to throw up in the car.
That's true. There's never escaping, right? So it's one win, take one win, take one loss, and, just keep moving forward, I guess.
Exactly. But it is really nice to just say, okay, everyone buckled, and then you're able to go rather than.
Yeah. And then no more car seats. That's another thing. I'm almost there.
Bonnie, I feel like you might be at this age. My daughter, she's almost 6. She's at the age where she can buckle herself, but it takes a really long time.
Yes.
But she does not. there is no help allowed. And so I'm just waiting and waiting. It would be so much quicker if I could do it myself, but it sounds like you might be at that age for a couple.
Yes. Yeah. My husband's car, like the buckle, like kind of sneaks into the hole. Right. And so like they're trying to jab it in and it's just like, it's not working. And you're just like, come on, but you want to teach independence and, build up their confidence. So it's just like, then the level of patience just needs to grow in myself. So I totally get it. I'm right
all
with
the
you.
Things. Oh, motherhood.
Exactly.
As you already said, you are a pharmacist and a mom of 4 with quite the age range. Mm-hmm. You surely see all kinds of things between both of those roles. I know personally, I am sometimes overwhelmed at the thought of germs and whatever illness is currently making its way around the daycares and schools. Yep. And different work functions. I only have 1 child and I don't deal with sick people for my job. So I can only imagine the added layers that brings to it. What are some of your top tips for moms or parents to help them protect their health and their kids' health?
Yes, great question. So when it comes to tips on protecting your own health, really for me, it comes down to developing healthy habits. The way to do that is to lower the barrier to entry, making it as easy as possible for yourself to create that habit, and repetition for it to become a habit. So I'll give you some examples. So we all know we need to drink our water, right? 6 to 8 cups a day to keep our body well functioning. Well, I'm all about getting your own nice, cute little light water bottle so that it's with you at all times. It's refillable. It's easy. You can add it in the bag on weekends and bring it with your kids. So it's always there. I don't know about you, when I'm traveling and if I forget my water bottle, I don't drink water, right? So it's this idea of like, make it close to you, make it easy so that you're doing the healthy habit. Right. The other thing is moving your body. I know we all know that we should get outside or move 30 minutes a day. Sometimes that can be overwhelming to busy moms like myself. These days, I kind of lower that and I say maybe just 10 minutes, right? Maybe it's just walk through the mailbox or going on a quick jog around the neighborhood before work starts. So, a fun kind of secret tip is that our body needs to do something at least 66 times for it to become a habit. And so for me, I started this habit of quick jog around the block about 7 years ago. I brought my gym bag to work, and on lunch breaks, I put on my clothes while my friends went out to lunch, and I just did it because I knew that there was no other time in the day. Before work, after work, it was all about the kids. And so that was my one time. And I did it 66 times to the point now, 7 years later, my body craves it. My body knows that that's what it needs. So this idea of repetition to create healthy habits is really important that I have found for myself. And then the last tip I'll say is putting your healthcare providers on speed dial, right? And that includes not just your primary care provider, your gynecologist, your dentist, but your pharmacist too. Of this idea that, you have them on hand. So it's easy to schedule appointments for yourself. It's easy to call them if you're getting all these, health information, from neighbors and stuff, and you don't know what's the truth. Well, call them and ask them. Why is it important to have them on speed dial? It's because how often are we like, oh, I should go see the doctor. And then you're like, but I don't know what to do. I don't know who to call. Like, I don't, and then you're like, never mind. If you have it on speed dial, we're able to take that next step a lot easier. I'm able to schedule my kids' appointments a lot faster, a lot easier. I will say, I still schedule, I'm prone to schedule my kids' appointments and I forget my own, because as busy moms, it's like, let's put the kids first, right? Let's make sure they're taken care of. And then at the end of the day, I'm like, wait, when was the last time I saw the doctor? Or when was the last time I was caught up in my own health? And so I think this conversation is really great to talk about as busy moms. How do we put ourselves first, even if we're busy taking care of others?
Yes. And we're going to talk more about that in a little bit.
Yeah.
But awesome. I wholeheartedly agree with that whole doctor piece, putting the kids first. It comes up a lot. So you have water, you have movement, and you have having the doctors on speed dial. But really, that to me also sounded like building a relationship with your medical care providers so that they know you and your history. Those are 3 awesome tips. Are there any secret tips that you can share that we might find kind of surprising, that maybe we don't hear all the time? To our Patreon supporters, thank you. We appreciate you so much. Our goal has always been for moms to know they're not alone in the tough and challenging phases of motherhood. We know Mama Needs a Moment provides this to our listeners.
We are thrilled with the growth of the podcast over the past 2 years. Last year, Spotify shared that Mama Needs a Moment was in the top 30% most followed podcasts, was heard in 9 countries, and had more content than 97% of other creators in the family category.
We have recently launched a Patreon account for Mama Needs a Moment. This is a great way for you to provide additional support to Her Health Collective.
We've set up 3 options for Patreon supporters, each with its very own perks, such as special events, discounts, and bonus content from each and every podcast guest that is available only to our Patreon supporters.
Will you become a Patreon supporter? It would mean the world to us.
Secret tips, I would say that, as moms, a lot of times we think our kids aren't really listening, or that our own behavior doesn't really matter, and that they're too young, they're not really gonna remember this. And this was a transition for me when my kids were infants. That may have been the case, but now that they're older, they do see and hear and understand kind of everything that we do. And it's scary because it makes us even more accountable for the things that we do. And so that brings me to kind of, again, the modeling of healthy habits. It makes it that much more important to know, okay, mommy's taking care of herself, or mommy is making sure that we are getting the care that we need when we get hurt, or when it's flu season and we need to get our flu vaccine. All of those habits, they see what we do, even if we think that, they're too young to understand it. So I think that's one thing that comes to mind that we kind of overlook oftentimes as parents.
They are always watching. I'm always surprised when my daughter mentions something that I didn't think she would have picked up on or wasn't even paying attention to. And it's weeks later and she brings it up and I'm like, oh,
yes.
Noted, you are listening and you are watching. That's a great point. You had mentioned earlier getting health information from the neighbors and all these different places. And that's really part of why we started Her Health Collective, because both Cindy and I, at different stages of motherhood, but we still felt overwhelmed by quote unquote Dr. Google. We had these health questions and we went and we were doing our due diligence. We were doing research, but we had input from all these different places saying all these, and sometimes they're reputable sources and they're saying 2, 3, 4 different things, and we don't know who to trust. So you had mentioned this a bit earlier, and I'd love to know, how do you suggest moms navigate the constant deluge of health advice that comes at us from all sides?
Yeah. This question reminds me of when I first gave birth to my kids, right? And like, you have a newborn, especially your first newborn. And then everyone's kind of saying, do this, do that, or have you done this? And it just gets so overwhelming and you don't know where to go. You don't know who to trust. And so going back to what I was mentioning earlier about, we have healthcare providers on hand that we can ask, and they are our resource. And we don't just need to go to them when we're sick, but we can go to them when we have a question like that. I'll say pharmacists in particular, we're great resources. We're very accessible out in the community, right? And so it just is a phone call away to kind of ask those questions. Remembering, again, healthcare providers are resources out in the community for us busy moms. And then you mentioned reputable sources. I would say too, yes, just kind of ask yourself, okay, where is this information coming from? Is it coming from a reputable source like the CDC or the FDA? Asking that next layer of questioning around the sources that people who are telling us things are using. That can kind of give us a layer of questioning for ourselves to make sure that we are trusting the things that are coming at us.
Thank you so much. I always love hearing any tips that professionals have to make my life easier. So I really appreciate you sharing that information for sure. I alluded to this a little bit earlier about how parenting just changes. And that's because my husband and I have an almost 13-year-old. She turns 13 next week. And we also have a 10-and-a-half-year-old. So it really does. I mean, you don't have to buckle them in anymore, but there is still the fighting. And we just had someone throw up like 2 weeks ago. So it all is still there. But my husband and I chose to do a modified vaccination schedule where the girls still receive all of their vaccinations, but they've just been more spread out. Mm-hmm. And in the time since we've given birth in the 13 and plus years, the CDC has updated its vaccination recommendation. Can you talk us through that? Why did they feel it was necessary to update the vaccination schedule. And along with that, could you share about how we as parents may not have the same vaccine protection as our children?
Yes, absolutely. And first up, I'll say that, I'm so glad that you found an approach that worked for you and your kids and your family, that you're comfortable with doing, and yet still giving them the protection that they need. I know that kids' vaccinations is top of mind right now because we're talking about moms and taking care of our kids. What's often overlooked is the updates to the adult vaccination schedule. When it comes to the CDC, what I wanted to mention was that just last year, the CDC did update their adult immunization schedule and now recommends that all adults ages 19 to 59 are vaccinated against hepatitis B. And so with the addition of Hep B vaccine, there's now actually 6 vaccines that the CDC recommends for adults, and that's Tdap, shingles, pneumonia, flu, COVID-19, and now hepatitis B. And so I think that speaks to the fact of just how important it is to protect ourselves against hepatitis B. In fact, it's actually 100 times more infectious than HIV. I don't know if we realize that, but 100 times more infectious than HIV. And since most people with hepatitis B are unaware that they have it, the virus can kind of unknowingly spread to others. In fact, currently 2.5 million people live with chronic hepatitis B in this country today. And if it's left unmanaged, 1 of 4 of those individuals will die from either liver failure or cancer. So unfortunately, there's no cure for hepatitis B at this moment. So that really the best way is prevention through vaccination. And so you asked why might perhaps our kids be protected against hepatitis B, but not us as adults. What's really interesting is that in 1991, the hepatitis B vaccine became the standard of care for infants, making it one of the first vaccines that you get before even leaving the hospital when you're born. But if you were born before 1991, you may likely be unprotected against hepatitis B. So that's why it's important for us, especially as busy moms, to make sure that we're caught up with our vaccinations, and in particular against hepatitis B.
Quick question for you in there. So how do you know if you've been vaccinated against hepatitis B if you don't have all of your records?
That's a great question. And I think that shows, that there's a gap in our healthcare system, right? Where, if you don't have your medical records, if your doctor doesn't, then it's possible that you might not know. And so the CDC recommends that either if you're not protected or if you're not sure, that you go ahead and get yourself protected against hepatitis B.
Okay. So it's okay for you to get it again, even if you've had it once before.
Yes, the CDC says, if you're not sure, then go ahead and get protected.
Interesting. Yep. Okay. Mm-hmm. And then name the others for adults again.
Yep. So it's Tdap, which is that tetanus, diphtheria, pertussis vaccine. So many of us, in pregnancy, it's required to get. So that's that Tdap vaccine. Shingles, pneumonia, flu, COVID-19, and then now hepatitis B.
Okay. And are all of the others safe to get even if you don't know if you have it? So the tetanus, what do you get tetanus every 10 years or so? Every 10?
Yeah. So when you get the first one, which is usually that combo of tetanus, diphtheria, and pertussis, you get that first. And then every 10 years is just the tetanus part as a booster. So usually as women or as moms, we've gotten that Tdap, that full with pertussis, because that's what protects our kids, our infants as they get born. But yes, then it's every 10 years from there. But similarly, kind of across the board, CDC says, if you're not sure if you're protected, then go ahead and get vaccinated. And I will say that each of those vaccines kind of has their own kind of age recommendation and all that for when to get those vaccines. So I would check with your pharmacist or your healthcare provider to see if you're kind of at the right age or stage in life to get it. But those are the adult required vaccinations according to the CDC at this point in time. Updates to the children's vaccination schedule. The biggest one I'll say is around, this was again, back in 1991, with the addition of the hepatitis B vaccine being standard of care for infants, they have come out with some specifics around being able to delay vaccines for kids. Generally speaking, I think CDC is the best resource for kind of looking at the children's vaccination recommendations and any kind of specific updates that they have. And so I'll just add that, since we're on the topic of hepatitis B vaccine, it's oftentimes administered over 3 doses. in 6 months. Generally speaking, any vaccine that has a multi-dose series, it's highly recommended that you complete the whole series to get the full protection. 3 doses in 6 months, as you can imagine, it's hard for busy moms, right? It's like, let's just say, summertime, we have more time or whatnot to, stay up to date. And so you go and you get a vaccine in June, you go back in July to get the second dose. Well, 5 months after that, again, 6 month series, you're in December now, right? It's Christmas time. It's probably one of the busiest times for moms. It's very likely that you may forget to complete that series. But the great thing is that there are other options now when it comes to the hepatitis B vaccine. And there's one option in particular that I like. It's called Hepatitis B, and that's only 2 doses in 1 month. So you can kind of get it done in June, go back in July, and you're done. And you kind of have that full protection. And the side effects are the same that you would expect with any vaccine: soreness in your arm, tiredness, and maybe some headache. But again, really the same thing that you would get with any type of injection.
Oh, that's wonderful to hear. And is that where you do it every 10 years?
Once you're done with your series, that's it. You're covered. Yep. So again, as long as you complete the series, you are good to go.
Fantastic. Thank you so much, Bonnie. It was such a joy to speak with you.
Absolutely. Thank you for your time. I appreciate it, Chrissy and Cindy. Thank you so much for having us on.
So many important tips from Bonnie today. Here are my top 3 takeaways from part 1 of our conversation. 1, repetition is key to making a healthy habit stick. Our body needs to do something 66 times before it becomes a habit. The best ways to do this is to make the healthy habit as easy as possible and remove as many barriers as we can. Extra motivation for doing all we can to develop those healthy habits, remembering that our kids are always watching and listening. Modeling those healthy habits are the easiest way to instill those same habits in our children. 2, it can be easy to put doctors on a pedestal and become overwhelmed or intimidated when we speak with them at our annual visits. It's important to remember that they are a resource and we are paying them to provide us care. We should feel comfortable asking them questions and, as Bonnie said, having them on speed dial. If something comes up, reach out to your doctor, your pediatrician, dentist, gynecologist, or your pharmacist. They have years of education and are there to answer your questions for you. 3, the CDC updated their vaccination recommendations for adults last year to now include a vaccination for hepatitis B. According to Bonnie, hepatitis B is 100 times more infectious than HIV. Most people with hepatitis B are unaware that they have it, making it more likely for the virus to be unknowingly spread to others. Currently, 2.5 million people live with chronic hepatitis B in the United States. If hepatitis B is left unmanaged, 1 of 4 of those individuals will die from liver failure or cancer. Unfortunately, there is no cure for hepatitis B at this point in time. So really, the best prevention is through vaccination. Be sure to discuss this with your doctor or pharmacist at your next visit. We hope you enjoyed part 1 of our conversation with Bonnie. Next week, we will share part 2, where we dive into how moms view the management of their family's health, 5 things parents can do to make sure they are caught up on their own health, and an exploration of health literacy. What it is, why it's important, and how we can use it to model good health habits for our family. This is a conversation you won't want to miss.
High five, friend. We've enjoyed hanging out with you. Follow us so you're the first to know when we drop a new episode.
If you've enjoyed your time with us, let us know by leaving a review. We always love hearing from you. Until next time, stay true to you.